Hi, I'm Bianca from Dr. Struck's office, and I'm going to go over what to expect before and after your abdominoplasty. Make sure you have a driver that's going to pick you up after surgery and stay with you for the first 24 hours. After your abdominoplasty, you're going to go home. You're going to have 2 drains on either side of your hips and a big white abdominal binder as well to compress the area. We will see you the very next day after your abdominoplasty. Open the binder, take a look at the drain color, make sure everything's good to go, and then you can go home that day. After we see you, you can shower. Make it kind of quick. It's not a luxurious shower. Try not to get any of that water in that area. The tape is supposed to be waterproof, but sometimes it's a little faulty. You want to make sure you're putting on that abdominal binder nice and tight. So after you shower, make sure you're putting on your abdominal binder nice and snug. You're going to pull it down. Make sure it's compressing that lower area. So you'll have 2 drains on either side of your hip for about the first 7 to 10 days. You want to make sure that you're paying attention to how much output you're having. And to do that, you're going to untwist the cap, look at the drain in the bulb, and just mark down on the sheet of paper that the surgery center gives you to keep track. After you note how much liquid you have in here, you could just empty it into the toilet and flush it away. To close back the bulb, you're just going to squeeze it nice and tight and then screw on the lid, and then it should be like a little raisin. So the more compressed, all that compression is going to pull the liquid towards the bulb. During your healing, you want to make sure you're not using any heating pads or any ice on the area because those nerves have been cut. You won't have complete sensation there. So no hot, no cold on the area. So after your procedure, you are going to want to sleep in a flexed position for about a week or until those drains have been removed. You don't want to sleep on your side because it's not going to let the fluid go through the drain. So sleep on your back in a flexed position. If you have a recliner, that works amazing. If not, a few pillows plopped behind the back and under the knees in a flexed position. So once your drains have reached about 24 milliliters for 24 hours consistently, we'll take those drains out. We will take that big bandage off of your tummy. We'll leave the stitches in the belly button in for a few extra days. Normally those come out at about day 10 or so, and you'll continue to wear that binder or a faja after. Compression is very important. It's going to stop the fluid from accumulating. It's going to help shape your waist, and it's also going to add extra support to that long incision. You'll be in compression for about 6 to 8 weeks after your procedure. Having some mild bleeding on that incision is completely normal. If there's anything that's leaking out, you can always give us a call, send us photos. Most people take off about 1 month from the gym or any exercise, and they're normally back at work anywhere from 10 days to 2 weeks. So that's the key facts on how to heal properly and what to expect after your abdominoplasty. We're excited for you, and happy healing.